What about our alternatives? Because as we can see, there's treatments we've looked at so far, they may be quite good, but they're not perfect. So we'll go into these more detail in a later video on alternative treatments that might help us solve or fix the epidemic of youth anxiety and depression. But here are 2 examples for depression. So researchers have started establishing novel interventions like memory specificity training and cognitive control training, which trains people to deal and avoid negative cognitions and thoughts. And this sounds a little bit like CBT, but it's a bit different. It doesn't focus on that behavioral aspect as much. And the second one in the second box is about mindfulness and mindfulness-based cognitive therapy. So I'm sure you've heard of mindfulness and meditation. It sort of draws on those kind of principles and encourages patients to notice their thoughts, be mindful about them, and it encourages meditation to pay attention to the present moment rather than getting all consumed by your negative thoughts. And this is showing emerging evidence, as you'll see in this study, that it may be more effective than traditional treatments like CBT. How about anxiety then? So again, we'll go into more detail on alternative or novel treatments for anxiety, aside from the medical and talking therapy models like exposure therapy. But here are 2 interesting examples I wanted to highlight in this lesson for you to get thinking for the homework. So actually, this applies for both the depression and anxiety, but recent studies suggest that ketamine, a illegal drug, but that is now being licensed for use in medical care, is effective at treating anxiety, and it's also been shown to be effective at treating some cases of depression, particularly treatment-resistant depression. So that's something that is very interesting to watch out for, and it's being introduced into some clinics in the USA and elsewhere. The second alternative is CBD and THC. So these are psychoactive compounds that are found in marijuana. And there are some theories that posit that CBD and THC can reduce anxiety symptoms and can make people feel more relaxed, particularly when there is a chronic health condition or primary health condition that is causing the anxiety or is linked to the anxiety. However, in general, or at least for now, evidence for CBD and THC as a cure or an effective treatment in the long term for anxiety is quite mixed because it's quite early stages. However, we need further research. So this is another interesting area that you might want to look into.